everybody, Justin White here, CEO and founder of Senior Health Services. Thanks for watching Medicare Monday. We're going to talk about avoiding scams. Isn't that stink that we even have to have this conversation? How do you avoid Medicare scams? They're going on all the time, and there's a few tips that I can give you that I think will eliminate just a whole lot of it. The first thing is that when you get a call that comes in that says possible scam or possible sales call or whatever, do yourself a favor and don't answer that call. If you get a call that comes in and it doesn't say that, and you answer the phone and it's clearly a sales call and you don't know who they are and you did not place that call, obviously because it's inbound, I would recommend going ahead and just hanging up and being done with that phone call. Especially if you're on the do not call list. Right now, there are a lot of shadier organizations, some are legit, many are shady, that have taken their phone rooms and they've moved them offshore, and they are now calling back to avoid the do not call list. They're calling back to the United States, which of course is illegal to do that, but they're doing it anyway, and it really, really chaps me. So if you don't know who they are, you didn't place an outbound call, and they're calling you and you hear noise in the background, it sounds a little jicky, a little shady, then just assume it is and get off that phone. We have had recently carriers, their phone rooms have been calling out, sometimes to existing clients and trying to upsell them or move them around on something. It's the same thing. If you did not make that call, I mean, you can listen to them. That's at least a little more credible, sort of, since it's the company you're with, but I'd still be very, very careful of that, okay? Go back, call your local agent that you trust, that you've been dealing with, and let them know what you need. It's better to be face-to-face in the same town and deal with somebody at least that you know who it is, because that is a real pain. We can usually unwind it, but what a pain in the rear. You don't want to have to do that, okay? So that's one thing. Just watch for those illicit phone calls. The second thing is that when they call you or somebody gets with you and you don't know who they are and you didn't initiate the conversation, do not give them your Medicare number and do not give them your social. Medicare does not place outbound phone calls, and Social Security rarely does. Usually when you're signing up initially, if they're asking for a form, but they rarely call. And plus, they've got that information. And you do not know, well, we need to know and prove that it's you. It's like, you're calling me, this is Jicky, why are you doing that? And you can hang up and then call them off the number on your card, and 9 times out of 10, they're gonna say, we did not call you, that was not us. It was a shady sales call that came in, okay? So, moral of the story, watch that phone. Man, if it's warning you about spam, screen it. You get on there, it's a sales call that you didn't initiate, get off the phone, and certainly don't give them private information, okay? If you do that, you're gonna save yourself a lot of grief. Thanks for watching Medicare Monday. I'm Justin White. We'll catch you next time. Bye.